ambulance setup. If we say that we want 100 ambulances, our Joint Secretary Finance will tell you, I've been consistently early morning I get up, first message goes to him, telling him like, no, please help me with this, please help me with that. It's not because of that, it's because we care for the people of the state of Goa. And we in Goa are a very small community, and we are community, like you mentioned, that you know everybody. In last 16 years, I think we know everybody. We grow up and they also progress in life. We also grow, but we know each one by name. We know each one, their commitment to the healthcare. I would like to not say much today, but today the healthcare in the state of Goa is on a very progressive path. There are several other initiatives which we are taking forward, and also state care is one of the programs which have consistently been saying. State care, sometimes, Sujana, the main our director has services and today afternoon also we are going to another place, and we are just trying to see how we can enhance the state care program. It's also going to be something like where we have these ambulances, and Mr. Bhatt were discussing our health services and everybody, where we are reaching out with facilities to the doorstep of the people, whether it is physiotherapy, palliative care, geriatric care, stroke patients, so that we have ambulance just like 108, and we are able to go to the homes of those people and see. And we have got a former director of health service who we want to put ahead of this program, so that we are able to reach. Also, the media is here. You have to understand many other issues which are not troubling my mind. The other issues that are troubling my mind is what we can do for the state of Goa. And with the blessings of people like Mr. Shripad, who has been in the Union Cabinet for so long, I mean, it becomes so easy for us that we have somebody, is like a godfather to all of us, that we, even without saying anything, he gives it to us. What I wanted to say is that when we have these programs like state cares, when we reach out to the people at home, when we have dialysis patients, we have a drop back facility for the dialysis patients, whether we have patients like, we have cancer and chemotherapy patients, so that is called the state care. Still today, nobody has actually, deciphered the whole thing, what I am trying to do on state care. And our state is very small, and if we are able to map the population, तुम्ही सगळे पत्रकार भाव बसल्यार, श्रीमंताचो श्रीमंत मनीस जर असल्यार त्याच्या घरा जर ताका वेळ ना, तो आईकडे पळोवंक शकना. हांवें पणजे बी पळयल्लें आसा, काही लोकांक ते मागीर कपडो बिपडो घेवन जाणटे लोक मागीर ते धडपडटात घरान की बाबा कोण आपल्याक पळोवपाक नासता. मिस्टर श्रीपाद नाईक सांगतले तुमकां, ते प्रचार खूब केला घरोघरी. म्हाका दिसता नॉर्थ गोवा तांकां अशें आमी एस्ट्रोलॉजर कशे वयता, तो मागीर आमचे आमी हातीर पळयतात न्ही लायन कशें आसा, ताका आपले पूर्ण मतदारसंघ आनी गोंयभर तो सगळे कडेन भोंवल्ले व्यक्तिमत्व. आनी ह्याच तरेन आमकां लोकांची चिंता आहा, ह्याच तरेन आमकां कितें तरी वेगळें करपाक जाय. When we talk of healthcare, it is taking it to the last mile. So as the vision of the Honorable Prime Minister Shri Modi ji, who says that you must take healthcare to the doorstep of the people. By just giving long speeches, it's not going to help us. It's important for us to encompass everybody in every strata of society to see that they come covered into this program of state care. Very important. Many times people require chemotherapy, they cannot reach the spot where they need to take chemotherapy. There are many dialysis patients, people don't have the time to take their relatives to do their dialysis. So this state care is something which will be one of the most innovative programs, and Goa will be the first state in the country to actually flag it off. And let me tell you, madam, is that when we have leaders like Mr. Shripad Naik, he is a very simple person. You know, if you go to other states, you'll wonder with 10, 12 cars, you'll see everybody coming with paraphernalia, actually seeing that, but our leader doesn't move like that. You don't even know where he's moving. Suddenly I cross him in the middle. I ask who's gone in this car. Then they say, okay, Mr. Shripad Naik has just passed. Because he goes to every startup, goes to every person and sees what is, and he's well experienced and a person who's very close to me, my family. And something which you need to learn from him is simplicity and commitment to the people of the state of Goa. And having a leader like this at the helm will definitely help the people of the state of Goa. I publicly तुमच्या सगळ्यांक घातलें आनी एक स्टेटमेंट आतां केलो तुमी, ते आतां विचार करत बसा तुमी कितें केलां तें. आनी बाकीचे प्रश्न विचारपाचे पयलीं तुमी बाकीचे हांव गुप्त नवरात्री आतां बेगीन येवपाचें आहा, ते गुप्त स्टेटमेंट कितें काडटा तेजेर लक्ष दियात. मेन म्हणजे ह्या तरेचें नेतृत्व असल्यार तो मागीर गरीब लोकांक सांबाळूंक शकता. गरीब जनतेक योग्य तरेचे बेश्टे मंत्री जालो म्हणून जायना. त्यांनी स्वताचे जिवनान जे अनुभव घेतल्या, स्वताचे जिवनान जे घटना घडल्या, ते आनी तेजे कमिटमेंट गोंयचे जनते खातीर फर्म केल्ले आसा. आनी म्हाका दिसता की त्या तरेचे नेतृत्वाचे मार्गदर्शन आमकां गावल्यार खुबशे बरे गोश्टी आमी करूं शकतले. I would like to thank you on this occasion that on the initiative of Mr. Shripad Naik ji, NTPC has taken a leap in trying to see that we are able to do good service to the people of the state of Goa, and definitely this initiative is going to help the 108 strengthen its life-saving initiative. Thank you so much, madam. Thank you.
Thank you, sir, for your inspiring and insightful address. Your vision for strengthening the state's healthcare system and your emphasis on collaborative efforts under CSR will undoubtedly motivate all to continue working towards accessible and quality healthcare for every citizen. Ladies and gentlemen, as we stand at the threshold of this remarkable event, it is with great honor and anticipation that I extend an invitation to our distinguished Honorable Minister of State for New and Renewable Energy, Government of India, Shri Shripad Naik ji, to deliver the address and share his insights with us. A strong advocate of collaborative development, Sir has played a key role in fostering partnerships with public sector undertakings to mobilize CSR support for strengthening public health care. His commitment to public welfare has helped translate meaningful partnerships into tangible benefits for the people of Goa. His visionary leadership and continued support have greatly contributed to the successful realization of such meaningful endeavors. With these words, it is my distinct honor to invite our esteemed Honorable Minister of State for New and Renewable Energy, Government of India, Shri Shripad Naik ji, sir, to address this august gathering.
Namaskar. Sri Vishwajit, Rane ji, Honorable Health Minister, Government of Goa. Ms. Vandana, Chaturvedi ji, Regional Head, HR, Western Region 1, Mumbai, Office of the NTPC Limited. Dean of Goa Medical College, Dr. Tiwari ji, Dr. Yurida ji, Director of Health, Dr. Rupa Naik ji, Dr. Kedar Raikar ji, Dr. Bhatt ji, friends from media, ladies and gentlemen. Today marks another significant milestone in our collective effort to strengthen the Goa's healthcare system. We are gathered here for the inauguration of handing over 19 healthcare vehicles to Director of Health Services under the Corporate Social Responsibility Initiative of NTPC Limited, Western Region, Mumbai. At the outset, I express my heartfelt gratitude to NTPC Limited for this generous contribution. This initiative demonstrates how public sector undertaking can become a strong partner in nation building by supporting the projects that directly benefit the people. The fleet comprises of 6 basic life support ambulances, 8 advanced life support ambulances, 2 cardiac ambulances, and 3 medical transportation vans. These vehicles will significantly enhance the Goa's emergency healthcare network by ensuring faster emergency response, better patient care during the transit, and efficient transportation of medicines to primary health centers and community health centers across the state. Friends, healthcare and education have always remained my highest priority. Every rupee allocated under the MP-led fund and every CSR partnership that we have facilitated has been guided by the objective of improving the quality of the life of our people. Today's event is a continuation of that commitment. Through CSR initiative, we have earlier facilitated 4 crore state-of-art mobile cancer detection van to Goa Medical College, enabling the early cancer screening across the state. Cancer detection bus has saved several lives due to the timely detection of cancer. We also played an important role in bringing central government support for super specialty hospital also, cancer block also. Our effort has also contributed to the establishment of the Ayush Hospital at Dhargar, 2 district hospitals, and the Ayush Research Center at Ribandar, strengthening the healthcare infrastructure across the Goa. I am pleased that NTPC has also sanctioned 6 crore under the CSR program, and by that fund we have allocated this 19 ambulances and other vehicles. During the 18th Lok Sabha, we have also focused on education, renewable energy, social welfare, and community infrastructure. Under the CSR initiative of Foodco, 4 school buses have been provided to the educational institution at Talavli, Sakli, Kepe, and Pinna, benefiting the hundreds of students every day. With the support of IRIDA, we inaugurated 45 kilowatt solar power plant for the drinking water department at Kadamba Plateau, Old Goa, promoting the clean energy in public infrastructure. Through the Goa CSR Authority, several solar power projects have been installed at community halls, temples, schools, and the public institutions across the Ponda, Ribandar, Old Goa, and other parts of the state, reducing the energy costs and promoting the sustainable development. Under the MP-led and CSR initiative, we have also donated 3 hearse vans to the village panchayat, providing a computer to the IT equipment in schools for across the Goa. Installed a CCTV system in educational institutions. Distributed motorized 3-wheeler and electrical wheelchair to Divyang benefit, empowering them with the greater mobility and dignity. Handing over an ambulance to the Institute of Psychiatry and Human Behavior at Bambolim also, provide an artificial limb beneficiary in many villages. Supported the construction of community halls, crematorium, infrastructure, school facilities, compound halls, pathways, and other community assets under the MP-led fund. Promoted renewable energy through additional on-grid solar project in temples and community halls. This project reflected our commitment to the inclusive development, where healthcare, education, renewable energy, social welfare, and rural infrastructure move forward together. I sincerely appreciate Mrs. Vandana Chaturvedi ji, Executive Director, NTPC Western Region 1, and her entire team for choosing healthcare as a priority under CSR. I also compliment Honorable Ministry of Health, whose guidance and his efforts. All the projects are going smoothly, and we are adding many benefits to the people of Goa. I also compliment the Director of Health Services under the leadership of Dr. Rupa Naik, the Goa CSR Authority, the DHS CSR team, and led by the Kedar Raikar, and all officers and stakeholders who have worked tirelessly to make this initiative successful. I remain committed to bringing more central assistance, encouraging greater CSR participation, and ensuring that every available resource is utilized transparently and effectively for the welfare of our Goan people. Together, we will continue building a healthier, stronger, and more prosperous Goa. With these words, I once again give my condolence, Dr. Vandana Dhume, ex-Director of Director of Health, and request God to give the strength to give him the strength to have this what you call sorrow, to end this sorrow with his family. Thank you very much.
Thank you, sir. We are deeply honored to have had the privilege of listening to someone of your caliber. I extend our sincere gratitude for your time and your genuine commitment to making today's event a truly memorable one. As we